So today I will be teaching you about IVs and how to, I will be talking about IV pushes, IV piggybacks. I will show you how to do a flush, how to do a spike, all sorts, different types of things that have to do with IV. So this is an IV lesson by Maribel Leyva. Next thing you're going to do is you're going to, before you go into the door, into the room of the patient, you will verify provider's orders and care plan, maintain standard precautions, and then you will knock on the door. And then once you go in, you will provide patient privacy by closing the door and the curtain. Perform hand hygiene, and then you will introduce yourself and your title. And in the midst of all that, you will be doing some caring behaviors. Well, you can sit down and explain the procedure to them and look at them in the eye, be professionally dressed, and make sure you touch them. You can shake their hand or whatever you want to choose of the caring behaviors. Next thing you'll do is you'll have to identify the patient, and this is very critical. You will identify the patient with the name and date of birth, and you will assess for allergies. So after this, you will gather the supplies that you need. You will get the IV kit and open that up, and then you will get all the stuff and pull it all out. Make sure you get the right size gauge needle for your patient, depending on what kind of thing you're going to put into them, what kind of solution, or what kind of procedure you're going to be doing. And once you do that, I have a video that's coming up right after this, and it'll show you exactly on how to insert the gauge, the needle into the vein. Okay, so we have our IV starter kits, and before we begin to put it in, we will make sure that we know the exact needle size, the gauge, depending on what type of IV your patient will need. And so we have the 18 gauge, which is the biggest one, and it's green. And we have the 20, which is the pink, and that's middle. And then we have the smallest one, which is the 22, which is this one. It's kind of like a butterfly one. And so the 22 would be good for outpatient, for testing, or just need to get some drugs into the system, into the bloodstream. The 18, they're bigger, and it's green, and it's basically to give blood transfusions for the red blood cells won't break up. And you can do boluses or whatever. So 18 is green, 20 is pink, 22 is the smallest, and that's this one, the butterfly. And so you have to make sure what kind of IV your patient will need. So make sure you get the correct gauge so the patient won't need to be stuck multiple times, okay? The first thing you need is your tourniquet, and your tourniquet's going to allow you to get a good look at a vein and to pick your vein, okay? And so then we have the tape, and the tape will be used, it will be cut into two ways, so it'll be like this, two ways. So then you can peel several inches and tear the tape in half the long way, so each piece of tape could go around the IV cannula part, okay? The next thing is the the cleaner, and so you always, this is used to prevent infection, so always clean the site after you find the vein to prevent infection, okay? And so this is very important. We don't want to infect, okay? So then we have, the next thing we have is our Tegaderm, and this is the Tegaderm. And so with the Tegaderm, we are going to, this basically, you put your initials, your dates, and the gauge size, and this is going to help, it's going to let incoming nurses know how long the IV has been in, if it's expired, if it needs to be changed, and it's also going to show who started it with your initials there and the gauge size. we'll be okay with that if we have all that information. Then we have the gauze, and that's to get the blood around the injection site if we get any blood and we have to clean it up or whatever we have to do. So the next thing we have is we have the IV extension, and this is the IV extension, and it comes just like this. And so then we have the flush, and this flush usually comes with a bubble. So once we have the bubble, we go and we can flick it like this, okay? And you're going to get the air bubble out. And so once you get the air bubble out, you have a little squeeze out, and this saline flush will connect to your IV extension, and you're going to connect it and from the white part to this purple tubing, and you're just going to twist it in to make sure it screws in tight. Okay, and so once we have that, we get the air out. We make sure we keep it in a sterile place because we don't want to contaminate it. Okay, so we're just going to go ahead and set it down just like that. Okay. And so once we have that, we want to make sure we keep the cap off. So then once we have the finger, we have our finger on this, on the compressed down on the IV line. So when the blood comes out of the IV line, we keep it clean and sterile. Okay. So the needle, the 22 gauge needle, we will go ahead and press down onto it after we have found our vein and everything. And we will open the needle, and we will put this in the IV, and once we put it into the IV like that, we will, once you get the draw of the blood, which it'll be in this little compatible thing compartment. Once you see the blood right here, you'll see the blood filling, then you can go ahead and just this little thing right here, you will click it into the thing, and that will just allow the needle to come out. And be careful with the needle because you will pull it out like that, and this right here stays in there. So once you remove the needle, you're going to go ahead and you're going to feel around the site. Make sure there is no bubbles, and feel around the site. And so if the patient says, ouch, it hurts, you're probably in the wrong place. So that's not a good sign. So, and so the saline is basically means that it's being surrounded, it's going in surrounding tissues, and it's influctuated. Okay. So if the patient says, oh, that's cool, it's a cool feeling, it feels like something is dripping down my arm, or I can taste or smell something, that is a good sign because your saline is in the vein. Okay. So after you tape under, you're going to tape it, and you're going to tape under the wings and crisscross. And once that is in, then you've put in the IV insertion with all your things, and that'll conclude that part. So next, the IV therapy. The goal of IV therapy is to take the bag of the solution and to get the solution into the patient's bloodstream. So the pump will regulate it, and it will go into the patient's bloodstream. This is a route of how to give medication. Okay, so there's two things that you have to do for the tubing. You will have to spike and prime the tubing. Spiking an IV bag means that you will use the spike from the tubing to penetrate the bag so you can withdraw the solution so it can go into the patient's bloodstream. Priming the IV tubing means that you're going to take the solution and put it through the line, remove any air because you don't want to inject that air into the patient's bloodstream because it can cause an embolism. As a nurse, you will be doing this all the time, so get familiar with this skill and practice this a lot. This is standard care. So after priming and spiking the tubing, the first thing you will do is perform hand hygiene, because this skill requires that you use aseptic technique. You want to be very careful not to contaminate the bag or the IV tubing, because that could cause an infection. So the next slide is going to be a short video of how to do the whole tubing and how to prime it and spike it. Okay. So